Welcome to LV Scary Stories, where the veil between the living and the unknown is always just a little too thin. Hospitals are places of healing, hope, and recovery, but they can also be home to eerie, unexplainable encounters. Tonight, we'll explore 4 chilling stories from patients who found themselves face to face with the paranormal during their time in the hospital. From ghostly visitors to unsettling apparitions, these tales will make you think twice about what truly lingers in the halls of healing. Turn down the lights, settle in, and let's dive into the unknown. Story number 1. I had been experiencing pain around my rectum whenever I used the toilet. Sometimes I noticed bright red blood in the toilet after having a bowel movement. My stools were narrower than usual. The more I researched my symptoms online, the more I found they pointed to either hemorrhoids or colon cancer. To protect myself from negative thoughts, I avoided reading anything about colon cancer, since my symptoms closely resembled those of hemorrhoids. I convinced myself it was probably internal hemorrhoids causing the pain and the narrowed stools. I bought all kinds of over-the-counter medications for hemorrhoids, and they helped manage the symptoms for about a month. But then things got worse. It reached the point where I had to induce watery diarrhea just to have a bowel movement. This complication began to worry me, and I couldn't stop thinking, what if? What if it was something more serious? What if it was cancer? I eventually went to the emergency department. The doctor there performed a digital rectal exam, which was excruciatingly painful. Because I was unable to pass gas, a CT scan was ordered. The scan revealed something unusual, so I was admitted to the hospital. The ED doctor informed me that a colorectal specialist would be consulted. That night, around 10 p.m., a doctor came into my room and introduced himself as Dr. Tumbong, a colorectal surgeon. He explained that he needed to perform an assessment and instructed me to turn onto my left side so he could examine my rectum. Unlike the ED doctor, he didn't seem to use any lubricant before performing the exam. Before I could react, he inserted his finger, and the pain was unbearable. I was screaming. After the exam, Dr. Tumbong told me he would review my case and come up with a plan, then he left the room. I couldn't help but feel that some doctors lack social skills or bedside manners. Not all of them, but some are just strange. That night, I couldn't sleep. My rectum was inflamed, and the hospital bed was so uncomfortable that I spent the night twisting and turning. The next day, a different doctor came to see me. He introduced himself as Dr. Phillips, another colorectal surgeon. He explained that he needed to perform an assessment. He put on gloves, applied lubricant, and asked me to turn onto my left side. I told him about the excruciating pain I experienced when Dr. Tumbong examined me the night before. I even asked him, why does everyone who comes in just want to stick their finger up me? What Dr. Phillips said next sent chills down my spine. I don't know who saw you last night, he said, but Dr. Tumbong recently passed away. I'm the surgeon covering for the hospital. I was stunned. Despite this unsettling revelation, Dr. Phillips performed the exam. Later that day, he informed me that to relieve my symptoms, I would need a temporary colostomy. The labs, scans, and biopsy results confirmed that I had rectal cancer. This marked the beginning of my long cancer treatment journey. I'm doing better now. Ultimately, I ended up with a permanent colostomy, but I've come to terms with it. It's better than the alternative, which is death. Story number 2. At one point in my life, I was homeless and living under a bridge with some other folks. I'm also diabetic and had developed an ulcer on my right shin. One day, the pain in my shin became so severe that I couldn't walk. It felt like there was some sort of electrical activity beneath the scab, almost as if something was moving under it. I ended up going to the hospital, where a general surgeon was consulted. When the surgeon came to see me, he assessed my right leg and confirmed there was movement underneath the scab. He suspected there were maggots under the wound. The surgeon explained what to expect during surgery, warning me that there was a high chance I might lose my lower right leg. After discussing the risks and benefits, I signed the consent form. Shortly afterward, I was taken to the operating room. I don't remember much, because they knocked me out completely for the surgery. The next thing I knew, I woke up in my hospital room feeling nauseous. A little later, the surgeon came to speak with me about the procedure. As expected, they had amputated my lower right leg. The surgeon explained that there had been a lot of maggots under the scab, but surprisingly, he believed the maggots had been eating the necrotic tissue, which might have prevented a severe infection. The plan was to treat me with IV antibiotics, do some physical therapy over the next few days, and then possibly discharge me to a rehabilitation facility. One day, while I was in bed doing some leg exercises, a man in a wheelchair from the next room came by. He saw my leg and came to my door to introduce himself. His name was Victor. He showed me his legs, or rather, where his legs used to be. Both of his lower legs had been amputated due to uncontrollable diabetes. He also told me he had terminal liver cancer. Victor came by to talk with me several times while I was there. He was a kind and cheerful man, despite everything he was going through. He had a big, loving family that visited him often. Early one morning, at around 4 a.m., I heard a knock on my door. I groggily looked up and saw Victor. He walked into my room, sat on the side of my bed, and told me to take care of myself because he was leaving. I stared at him, surprised. "Did they fix you? You look great," I said. "It's good to see you up and walking around." He just smiled, patted my leg, and walked out the door. I was still a little groggy from the morphine shot the nurse had given me earlier, so I tried to go back to sleep. But then, suddenly I snapped out of it. Something felt off. I looked for my call light, but it was on the floor. I started calling out for my nurse, and eventually, she came in. "Please, can you check on Victor next door?" I asked. I just saw him walking into my room, and then he walked out. The nurse looked at me, confused. "Victor can't walk," she said. "Please," I begged, "just check on him, please." She left the room, and moments later, I heard a commotion as several staff members rushed into Victor's room. A short time later, I learned that Victor had passed away in his bed. He was a DNR, do not resuscitate, so the staff didn't attempt to revive him. He had been battling terminal liver cancer, and his time had come. I truly believe that even though our physical bodies may suffer from illness or injury, our souls remain whole. Victor came to say goodbye that morning, not with his broken body, but with his intact spirit. Thank you for listening. Story number 3. I had a benign tumor that needed to be surgically removed, so my surgery was scheduled for a Tuesday afternoon. My friend's cousin, Dawn, works in the operating room as a registered nurse. I didn't know Dawn all that well, but I had met him a few times at gatherings. When I arrived at the hospital, I checked in and was quickly taken to the pre-op room. There, the staff inserted 2 IVs into my arms and started IV fluids. Once everything was ready, they wheeled me on a gurney to the operating room. I remember lying there, looking up at the bright white light above me. My heart was racing and my anxiety was kicking in. Then I saw Dawn. Dawn came over, patted me on the shoulder, and said, "Don't worry, we'll take good care of you. When my friend Terry puts the oxygen mask on you, take some deep breaths and count to 10, okay?" I nodded. After that, all I remember was starting to count. They must have given me some sedatives through the IV because I was out cold in no time. However, due to my history of relying on narcotic pain medication, I have a strong tolerance to the meds they were giving me. I kept waking up briefly during the surgery, and they had to sedate me again each time. What I vaguely remember from those moments is that everyone in the operating room was wearing masks, gowns, and gloves, except for one person. There was a man standing off to the side who wasn't wearing a mask or gloves. He was in a hospital gown, bald, and had tattoos on his head. He was just standing there, looking at me. It felt dreamlike, and before I could process it, they sedated me again. The surgery went well, and soon I was waking up in the recovery room. Later, they moved me to my own room for the night. That evening, Don stopped by to check on me after his shift. I was feeling better, and my surgical site looked good. Don came in joking and said, "I'm sorry, dude, but I wasn't the one who inserted that Foley catheter. I didn't see anything, but I did tell them to be gentle." We both laughed and started talking for a bit. I mentioned how surprised I was that everyone in the operating room was so thoroughly masked, gloved, and gowned. I asked if it was because they were expecting the surgery to be especially bloody. Dawn explained that they always have to cover up, whether the surgery is bloody or not. The masks are to protect the surgical team from splashes, and also to prevent them from breathing on the surgical site and potentially causing an infection. That's when I told Dawn about the man I saw during surgery, the one who wasn't covered up at all. Dawn looked at me curiously and asked me to describe the man. When I described him, Dawn's expression changed, and he hesitated for a moment. Then he asked, "Do you believe in ghosts?" Dawn explained that earlier that morning, a man had been brought into the operating room for emergency surgery after a drive-by shooting. Despite their best efforts, he didn't survive. Dawn said the description I gave matched the man who had died in that room earlier in the day. Hearing that sent chills down my spine. I don't even believe in ghosts or have any religious affiliation. Maybe it was just a hallucination caused by the IV meds they gave me during surgery, but maybe it wasn't. Story number 4. I have cancer and was undergoing chemotherapy and radiation until my doctors determined it was safe to proceed with surgery. A surgery date was scheduled, and on that day, I went to the hospital and checked in. The plan was to perform the surgery, and if I was stable, admit me to a medical surgical unit afterward. This happened during the 2020 lockdown, so no visitors were allowed in the hospital at the time. I remember going in and having the surgery. Everything went well, and after spending some time in the recovery unit, they moved me to my room on the medical surgical unit. My room had 2 beds, one by the door and one by the window, separated by a curtain. They placed me in the bed by the door. Still groggy from the surgery, I drifted in and out of sleep. At some point, the patient in the next bed started talking to me. I only caught bits and pieces of what he said because I kept dozing off. I remember him saying something like, "Don't go reading about your cancer on the internet. The statistics are outdated and will just give you anxiety. Also, don't watch videos of people sharing their cancer journeys on YouTube. When you check their channels later, you'll notice they haven't posted in years, which probably means they've passed away. Lastly, avoid forums like Reddit. It's full of people sharing their worst-case scenarios as if no one ever gets better. The ones who are cured and move on with their lives don't stick around to post about it." Even in my half-asleep state, his words stuck with me. I vaguely responded with things like, "Yeah," and "okay." That night around 9 p.m., the housekeeper came by to sweep the floor and empty the trash in my room. She moved the curtain, and I saw that the bed next to me was still neatly made, completely empty. By then, I was wide awake. I asked the housekeeper about the patient in the other bed. She looked at me, confused, and said, "There hasn't been anyone in that bed for 2 days. You're the only one in this room." I was so confused. Maybe someone had come to visit while I was in and out of sleep. But this was during the 2020 lockdown, so that didn't seem possible. I still clearly remember the things that patient said to me. I don't know if this has anything to do with the paranormal, but I just wanted to share my experience. That's all for this video. Thank you for making all the way through and supporting my stories. Have a wonderful day or night.